That is roles and the core functions of community health nurse. So we have, who is this? Who is next? Let me see. We are just sharing so that I'm not exhausted. All the same, also we are having active participation. Boniface Ouma? No, there is someone here, Belvin Luswiti. Belvin Luswiti. Are you in?
Yes.
No. Let us try. Let me skip you so that we have got a balanced presentation. Boniface Ouma, because we have got two ladies who have already read. Then there is one guy now. Let us have one guy also. Boniface Ouma.
Yeah, so role and core functions of a community health nurse. So we've got core functions where one, we have assessment. In assessment, collect and analyze community health data. Number two, then we have policy development, where we have where he or she advocate for health policies, mobilize resources. Then number three, we've got assurance. Ensure services are provided equitably and effectively. Then we have got
Okay, you can.
expanded roles.
Yes.
One, we have health educator and promoter, advocate for vulnerable populations. Then can also be a coordinator of care across levels, also a researcher generating evidence-based practices, a leader in community mobilization and health campaigns, then a manager of community-based health projects. Then next we have roles of a public health nurse, where one conducted epidemiological surveillance and outbreak response. Next we have deliver immunization and screening programs. Third one, we have monitor environmental and occupational health risks. Number four, we have plan and implement health policies with multidisciplinary teams. Then promote disaster preparedness and response. Then lastly, we have work on reducing health disparities and inequities. Thank you.
Okay, thank you so much, Ouma. Okay, those are some of the roles. I know at some point you have learned about the roles of nurses when you studied this particular program of BSN. I know you have already covered this, so this is just a reminder. But now we are trying to narrow ourselves to community health nursing as a component under community health. So I know you know what is assessment. I know you have learned about the nursing process. So I won't be able to dwell on that so much because you have done it in medical surgical nursing. I know you have learned about assessment, thereby diagnosing, nursing diagnosis, intervention, yeah, planning and evaluation. It is just almost to this. It's just application when it comes to community health nursing. And then we have policy development. Now, when you're talking of policy development, it is whereby you are able to, when you see there is a problem in a particular community, and this community is at risk. So what do? You can do research. You can have a design a particular topic. You come up with your proposal, and then you go on to do what you call data collection. Now, after doing data collection, it is from this particular data that you have obtained from this particular people or study participants that you will be able to come out with some recommendations. Just in line with what you have done, you will come up with some recommendations. And recommendations is like you are trying to make to put across something that it is very important that you are trying to inform the government that or the system that there is a problem in a particular community. Just in reference to that particular data, yeah, the statistics that they have obtained from a particular community. And then from there, once you have recommended, it can be turned around now to be a policy. That particular recommendation, it becomes a policy. So you'll be able to develop a policy by saying that, you see, after doing this and this in this particular community, I have collected this information. You have got evidence. And then you can be able to present it to different forums whereby it becomes a policy. And then when you're talking of assurance, assurance is about quality, whereby we normally talk of quality management systems. Now, when you're talking of quality management system, we normally look at around around 5 issues when you're talking of quality. We normally talk of efficiency, effectiveness, patient-centered, safety, and then timeliness. Those are the key areas that we normally talk when we are talking of assurance, so that we can have, when you are providing these particular services, they have good quality. Now, if they are of good quality, are you able to provide equitably and in an effective way to that particular locality? So it is very important, very key. Those are the core functions of a community health nursing. And then the other ones, they come into play now, like health education, health promotion. You are advocating for the vulnerable population, that particular vicinity, and etc. Now, as much as we have got the functions or the roles of a community nurse, they go hand in hand with the public health nurse. Now, when you are referring to a public health nurse, they normally conduct surveys, epidemiological surveys, and it is in relation to some of these particular diseases whereby we normally talk of the epidemics and even pandemics. They try to respond to them. Furthermore, we cannot be able to say that even community health nurse cannot be able to offer immunization. Yes, these are just some of the key, the major ones. But even a community health nurse can be able to offer, is able, and is mandated to offer immunization, even screening services. Furthermore, in relation to public health nurse, they also look at the environment to find out if there is any risk factors. Now, when you're talking of risk factors, it's like one, pollution. If there is, this is the work of public health nurse, in line with even community health nurse, to come out and to be able to voice this particular problem to the relevant body so that appropriate measures can be taken. Another element regarding the roles of public health nurse is to implement health policies with other teams. Like when you're talking of multidisciplinary teams, you're talking of the nutrition department, the dental department, yeah, the clinical medicine department. So they come into play so that you work as a team. There is nobody who can be able in health sector. People work as a one team, because if you work in isolation, you won't be successful. So there is this element of working as a team. Another thing in relation to public health, they promote disaster preparedness and respond to it. For example, if there is fire, they are the guys who will come into play. If there is maybe a problem in a particular community, let us say we have got flooding, the floods have occurred in a particular area or locality, they come into play so that they can be able to rescue the issue. Now, they work on reducing health disparities and inequities. Yes, that is also another element, that is also another function of public health nurse.